also for coming here, all of you, especially on such a nice spring day. It's really nice to see this here.
Can I just say one thing? If you feel free to come and go out on this door, there should be some refreshments within the next 5 or 10 minutes, coffee and cookies and so forth. So thanks.
Thanks. And maybe just to put the record straight, PSI France also functions as my guest bedroom, so I'm working from home. So before, not to raise expectations there, I'm the only person based there. So as Doug mentioned, I'm a consultant and work for PSI throughout the different countries that we have programmed in. And as Dr. Evans mentioned, I'm here to talk about maps and about the role of geographic information systems, GIS. We'll see later what that stands for, or how we can define this, to support public health, marketing and communication activities. And maps, as you all know, they're everywhere these days. We see them in the news. We're familiar with Google Maps on the internet. We use them to find our way, to locate hotels or businesses, plan routes, or simply to explore foreign areas using Google Earth. We're also used to seeing maps about specific health issues in the media, including on the internet. And they're often very pretty, yet informative maps. For example, this diabetes map of the US by county, which was prepared and published by the Institute of Health Metrics and Evaluation. And just, I'm not going to go into too much detail here, but just looking at the map, a quick glance shows us that there's what we could call like a diabetes belt, all the way from the mid-Atlantic coast down to the Mexican border. And then there's Alaska that really stands out with very high prevalence rates. Certainly something to do with diet and other habits. So this is a very informative map, I think. And there are many examples of nicely animated time series maps, illustrating how a certain disease or health problem has spread over time. Think about HIV spreading gradually to all corners of the world, or H1N1 diffusion from the original center in Mexico through air travel, through major cities all over the world. And also avian influenza, as seen in this time series map, which was nicely prepared. And the red dots on the map show new cases of bird flu outbreaks, and then the boxes show the number of human cases and human deaths over each time a 6 months time period. And you can really see the spread from Southeast Asia all the way down to Europe and eventually down to Africa. So I'll play this again so you can really see how the maps, just within just a quick glance, you can really see what's going on and where problems are located. So this goes from, you can see the time slider up there, it goes from the start of 2004 all the way to 2007. Of course, I had to limit myself there because it's still spreading and still going on. And we'll see quite a few more health maps in the coming slides. But what my point is for now is really that maps are everywhere and that they allow us to better understand specific distribution patterns, to better understand relationships, and also, most importantly, they're very powerful communication tools, very visual tools in the sense that they have the capacity to really bring data to life and get people to actually look at the data and make better use of the data that's presented in maps. But so let's first take a few steps back and talk a little bit more about the origins of public health mapping and see how maps has played an important role in fighting some of history's most serious diseases. And afterwards I'll take you, and that's probably the main part of the talk here, about GIS applications to support health marketing and communications. So we'll see a number of examples of how these GIS techniques can support these interventions. Followed then by a more in-depth look into a case study from Madagascar, and then we'll conclude with some remarks on where the field of public health mapping is going in the near future. Now, maps have been around for thousands of years. In fact, the very first maps date back to at least 10,000 years ago. But the first health-related maps are not that old, actually. The medical cartography or disease mapping started probably around the middle of the 17th century, and then throughout the 18th century developed fairly slowly at a time when we knew very little about the origins of disease and about transmission modes. So it was mainly about plotting cases or deaths, and about tracking the spread of diseases such as first the plague, and then yellow fever, cholera, and so on. And towards the end of the 18th century, doctors and public health officials started using maps really as tools in their search to the causes of the diseases that they were facing. For example, Dr. Valentine Seaman in New York, who used maps to show how yellow fever was related to bad smells. And he used those maps to support his theory, which was then the predominant theory, the miasma theory. So he was linking cases to sites with bad smells and dirt and waste, which obviously we know that that's not the case right now. And this continued throughout the 19th century, and I was very pleased to find this map here of typhoid fever and malaria deaths in DC, in downtown DC, and I'm sure you all recognize the area. Unfortunately, but we are just off the map. You see that both diseases were very prevalent, and of course at the time, downtown DC was surrounded by vast swamps, which explains why both diseases were apparently so common. Now, moving on, actually, the most famous example of a historic disease map was that of John Snow's cholera map, and that's usually used as the textbook example of the origins of public health mapping. What he did was, so John Snow was a British physician who had the idea of mapping out not just the location of cholera deaths in this neighborhood in what's actually Soho these days. You're familiar here, there's Regent Street and Broad Street and so on. The map, actually his idea and the originality was that he was also depicting the location of public water pumps, wells where people were getting their water. And he realized that all those cases were located around a particular pump, which is the Broad Street pump. And even if you go there today, you'll find there's a monument, which is a pump that is there in honor of John Snow's investigation. And so by adding this additional piece of information, that's something that we call these days adding a new data layer in GIS language, it really showed us that there was something related to this pump. So, but actually by the time that the access to the pump was restricted on John Snow's request, the epidemic was already on the decline. So cases stopped, but he couldn't really prove that it's because of the water pump. But later investigations show that he was right in assuming that cholera was waterborne and not airborne, as was generally assumed in those days. And it actually turned out that this particular pump had been contaminated by a sewer line. So John Snow's map is generally considered as the first analytical public health map, and even by some as the basis of modern epidemiological investigation techniques. Now, moving on to the 20th century, public health practitioners start mapping mortality ratios and other statistics aggregated by administrative area, not anymore just dots cases on the map, but they were trying to already incorporate statistical approaches. For example, to correlate cancer mortality with certain environmental factors. More recently, towards the end of the 1960s, we've seen the emergence of GIS, computer-assisted mapping, as it was called at the time, and people have started using GIS technology to create multivariate maps, so maps that combine two or more variables, and to perform advanced spatial analysis. And like building spatial regression models or creating accessibility maps, of which we'll see a few examples later on. GIS rapidly became a firmly established discipline throughout, with applications throughout areas of urban planning, resource and land management, environmental science, marketing and distribution, and so on, including public health. GIS itself, so as I mentioned before, it stands for Geographic Information Systems, can be defined as a set of tools and procedures for the capture, storage, management, analysis, and display of spatial data. Spatial data is data that can be located geographically, which is just about any kind of data point. And it shouldn't be confused with a GPS, which is what I'm showing down there, which is this little device that allows you to record geographic coordinates, latitude and longitude, for example, of a health facility, which will then allow you to plot that point on the map in the right place. So there are lots of different GIS software packages. The most common is called ArcGIS, which is shown here. There's this screenshot here. And now, regardless of which tool you use, the real power of GIS resides in the fact that it allows you to bring different data sets together from different scales, different sources, different formats. And GIS really acts as a platform into which you can combine and correlate these different data sets, which we call GIS layers in GIS language. So the idea is generally to better understand and detect specific distribution patterns and to detect spatial relationships. So it's both a research tool, but also, as we'll see in the next few slides, very much an applied discipline that can be used as a very practical application. Now, at the start of the 21st century, mapping is no longer the exclusive domain of GIS specialists and researchers or urban planners and so on. But in the area of public health, for instance, GIS rapidly becomes a very standard tool that's used by a lot of ministries of health, international organizations such as the World Health Organization, also among health and humanitarian NGOs. The first map here is a typical WHO map that shows status of global guinea worm or dracunculiasis eradication, with countries color-coded by what they call the certification status, whether the disease has been eradicated yet or is in process of being so. And by the way, maps are actually very important tools to achieve eradication, because they allow you to really see where the last remaining cases are located. And the Carter Center and WHO are making every month very detailed maps that show every single endemic village, and then they send out health workers to ensure that the transmission is stopped, so down to the village level. During the last 5 years or so, we've seen simple web-based applications such as Google Maps that have made mapping much more accessible to a much larger audience, and they have enabled the creation of interactive web maps, such as this one from the London School of Hygiene and Tropical Medicine on resistance, or a particular type of resistance to anti-malarial drugs, which is an emerging public health problem. And the map is very interesting because there's some clear regional differences. So you can see from the legend, the color shows a percentage of data sets found to exhibit a mutation, which means resistance. So red means high resistance levels, blue or white, very low. And of course, the map again allows us to see those patterns, but what's important here is that these regional differences and variations may actually have important implications in terms of treatment policy, because it may be necessary to adjust malaria treatment to meet those specific resistance patterns. And like I said, without a map, it would be much harder to see those clusters and those specific distribution patterns. Now, maps that show the location of health facilities are also commonly used by ministries of health, and the same with the availability of various health services, as they allow for better resource allocation and to identify sites where new health sites or new health centers should be established, where they're likely to serve a larger population and where there's no overlap with existing health centers or clinics. And simple maps like this one from Tanzania, from a region in Tanzania which combines health facility locations with population distribution, or the one in the middle here, which is from Bujumbura in Burundi, which shows different types of health facilities. They can evolve into much more complex maps on accessibility. This example here is showing in the central Rift Valley in Ethiopia the average time to reach the nearest health facility as a walking distance, because that's what people do. And red areas are those where it takes 3 hours or more to reach the nearest clinic, and yellow or green areas are those where proximity is much better. You can combine this with the population distribution map again. It's always very important to see where people are located. And we can actually see that there are some of those red areas that are actually fairly densely populated in the south. On the other hand, the big red patch in the northeast is actually a very sparsely populated area. It's a nomadic Afar region in the northeast. So that again are important tools to find out where new health facilities should be established. So these are just some examples of typical health maps, and I could show lots and lots more. But so let's now focus a little bit more on the use of GIS and mapping to support social marketing interventions. And in general, health marketing and communications. The non-profit organization that I work for, so PSI, Population Service International, is running a range of different social marketing interventions in about 60 countries worldwide, from condom distribution to malaria prevention and treatment, providing family planning services and child survival. We also work a lot through the private sector for the distribution of, say, condoms. And we also run our own HIV counseling and testing sites in a lot of countries, as well as social franchise networks that deliver essential health services. We've adopted GIS some 6 to 7 years ago, and since that time a lot of our country offices are actively using GIS and maps to support decision making and to report on our achievements, whether that's to the local Ministry of Health or to the donors. And in the next few slides I'll show some examples that I hope will illustrate how GIS can be used as a decision-making tool for public health organizations. Specifically, how they improve monitoring, how they increase or stimulate data use by program managers, and how they can do a better job at targeting their intervention, especially when it comes to reaching vulnerable populations and optimizing distribution systems and resource allocation. So the first map here shows, it's a very typical PSI map, I would say, that shows condom availability in private sector outlets throughout Swaziland. We conducted a national census and identified and mapped out with GPS units close to about 4,000 outlets, so there's about 4,000 dots on this map, which we combined with a road network layer and population density. And you can also see national parks, the green areas, so it makes sense that there are no condom outlets in those areas. And we've used a simple color scheme to indicate which of these outlets, which could be pharmacies, kiosks, groceries, gas stations, bars, and so on, which of those have condoms in green, and which of them don't, which are the red dots. And that gives us quite an accurate picture of current availability and accessibility levels. Now, we could zoom in a little bit and single out a specific area. I think this is in the capital, in Mbabane, where we're looking now specifically at condom availability in and around what we call high-risk meeting venues. So places where people meet new sexual partners, for example, nightclubs and bars. They're shown as stars on the map. So the red stars are those bars and other high-risk venues where condoms are not available inside the venue. And the yellow ones are those where condoms are available, either public sector condoms that are available for free, or that are already in the room in the hotel, or other brands that are available for sale. We also included the actual outlets, so the small shops within those areas, which are the green dots, and we've used what is called a catchment area, those pink areas, which show an area of about a 200-meter radius, which we consider as the area from which that outlet would potentially attract customers. That's what a catchment area is, the service delivery area of an outlet or a service provider. This way we can find out which of those venues currently don't have access within that 200-meter radius and which ones have access, and we can identify sites that we should target to improve distribution. So you can see that there are several red stars that are likely to be too far away from the nearest condom outlet for people to access those condoms and eventually use them. Like I said, this is a very typical map. We'll see in the case study from Madagascar something similar, which I'll develop a little bit more. Now this very colorful and beautiful map here is from Zimbabwe, which is about HIV testing and counseling. So these are the blue triangles, and the background color shows, again, a distance, a straight line distance to the nearest facility. So red are again those areas where access is very low because people live far away from those sites, and the dots are villages and towns. Now, that's a good start, of course, but what's really interesting here is that because the number of sites is limited, we conduct mobile outreach sessions where we go to, especially remote rural areas. Mobile teams go out there and set up a mobile testing and counseling site. And the idea, of course, is to mostly visit those areas that have lowest access to the static new start sites, as we call them. And these are the purple dots. So again, the maps allow us to see whether we are achieving a good coverage, whether we are always going back to the same area, or on the opposite, if we're systematically moving from one place to the next to ensure that we give people access to this service. This is actually a nice opportunity also to show, and this is probably more of a theoretical example, of how GIS can be used to generalize data. And what we did here was to, in order to reveal maybe certain hidden patterns that wouldn't be very clear from a very busy map like this, something we did here is called spatial interpolation, where we took the HIV positivity rate as found during those mobile testing sessions, and that was represented by the size of those purple dots, and came up with an overall HIV prevalence map of Zimbabwe, which of course would need to be refined, but the idea is really here to see how you can move between different levels of analysis and different levels of detail when constructing and analyzing your maps. So this is what we call a raster image. From point-based observations, we generalize and interpolate the data to come up with a more general map. Let's again zoom in a little bit more to the, in this case, the northern corner here of Zimbabwe, where we see how the maps have been used by our office in Harare to identify which districts are underserved, are not well covered by those mobile outreach teams, which are the green districts here. And you can see the stars are again the static sites, and the map actually with those arrows show which teams will be sent out to those districts, and each fixed site has its own mobile team, and so one will take the district to the right, the central one will take the central district, and then the other one will travel all the way up north to make sure that those districts receive adequate coverage. So as you can see, maps have the potential for being important planning tools, and our Zimbabwe office also uses maps to plan their logistics. For example, to estimate distances and fuel allocation when going out to the field, especially to remote areas, or even to find optimal routes for distribution of condoms or other products, or for behavior change communication sessions in these rural areas. So again, maps become very useful planning tools. Another way that maps can be used is for actual planning distribution of health products. And this example here from Rwanda shows how we can use maps to identify priority sites for improving the availability of oral contraceptives. So we have a product, a subsidized oral contraceptive called Confiance pills. And again, we conducted a nationwide survey in private sector health outlets. So those include pharmacies, drugstores, and private clinics. And as we've seen before, it's useful to combine this with population distribution to see that there are some empty areas. Probably it's because, first of all, many of those have very low population densities. But it's actually rather difficult to get the overall picture from looking at a fairly busy map like this. So what we did was to aggregate data by administrative sector, which is about the equivalent of a US county, to look at the availability by sector and to also incorporate population distribution. So this map, as you can see from the legend, shows different things. One is, first of all, availability, which is indicated by green for this, meaning that the sector has at least one outlet where this product is available. And then yellow and red are those areas where the product is not currently available. And by incorporating population distribution, we're showing by the intensity of the color whether it's a high density area or a low density area. So anything that's dark green means product is available and high population density. Anything that's dark red means not available, and high population density. So it's those dark red areas that should be our priority sites to make sure that people get access to oral contraceptives in this case. The map also tells us for each sector whether there are any outlets, any potential outlets, whether we have the opportunity to make that product easily available. So if there's a blue dot, it means that there are some pharmacies or clinics. And so that means that, for example, some of the red sectors here, which have a blue dot, should be fairly easy to go out there, send out a sales rep, and convince that pharmacy owner to start selling our product. However, as you can see, most of the red sectors have a yellow dot in it. That means that there's not a single pharmacy, no clinics, no drug stores through which we could distribute the product. So that means that we need to find a different distribution channel and a different way of getting our product out there. Now, we could stop here, but it's probably useful to also look at distances, because Rwanda is a small country, accessibility is fairly good. So we may want to look at distances from, for each of those red sectors to the nearest existing outlet, which is shown by those blue circles, again that catchment area, which shows that there's actually quite a few sectors that are red, but that are within less than 5 kilometers from the nearest outlet. So those shouldn't be too much of a concern. What we really want to focus on are those red areas that are far away, because there's lots of people that are more than 5 or 10 kilometers away from the nearest outlet. And again, one of the functionalities of GIS is that by using this stepwise process, it can automatically generate a list, a table, which is shown down here, highlighting those sectors that have high population density and no current availability and that are too far away from existing outlets. So again, this is a very practical application where we can then give that list to our sales and distribution manager, who can then organize his teams to go out there. Maybe we need to find other distribution channels or set up community-based distribution or mobile teams who go out every now and then to sell or to distribute that product. So here's another example. This one is on ACTs in Uganda, where so ACTs, anti-malarial drug, in several districts of Uganda. Initially, these drugs were mostly made, or almost exclusively made available through public health facilities, and the only product in the private sector was Coartem, which is way too expensive for the majority of the population. So, because of the regular stockouts and lack of widespread accessibility to health centers, and because of the high cost of private sector products, it was decided to run a pilot to introduce a subsidized ACT into the private sector and see what the effect of that would be. And so we did this in 5 districts, one of which was the control district in the north. And again, aggregating this data, and this is at the end of the pilot, we could see at the ward level, which is a very detailed level, whether ACTs are available only through the public sector, or only through the private sector, or whether affordable ACTs are available in both private and public sector, which are the purple areas. And these maps were part of our argumentation that introducing affordable ACTs into the private sector is actually an effective way to improve accessibility and ultimately to improve appropriate malaria treatment-seeking behavior. So we've seen how GIS and maps can be used to better plan, to target interventions, and even to support policy changes. So let's now move to Pakistan, where the social marketing organization Green Star, which is PSI's local affiliate, is running a network, a large social franchise network that mainly delivers family planning services throughout the country. And these Green Star clinics, as they're called, are located, as I said, in most corners, most districts, and it's very important that we can monitor the quality of the services that they provide. And we did again an extensive survey, census of all 6,000 or so clinics, all of which were mapped using GPS units and then plotted on the map. And as you can imagine, that's quite a large data set, lots of variables, 6,000 records that could be quite difficult or cumbersome to analyze and to make sense of. So what we did was to display that information on the map, and rather than looking at simple clinic locations as we've seen in the previous maps, we've looked at the district level distribution, but again, that doesn't tell us much. Okay, you could see that there's lots of clinics in one area, but not so much elsewhere. But how does that then relate to population distribution? In order to answer that question, we calculated a clinic to population ratio. So this map shows the number of Green Star clinics per 100,000 people. And green means there's a lot of clinics in proportion to the population, and it shows a rather different pattern compared to the first map. You can see that there's some of the dark green areas actually become red simply because there's a lot of people, but not enough clinics in relation to that population size. So we can easily identify the 3 or 4 districts that have a very low clinic to population density, as well as certain clusters or groups of districts where in general the accessibility or the coverage by those clinics is very low. As I just mentioned, we also need to monitor the quality of that network, and that's something that's shown here in this map of the remote Northwest Frontier Province, which shows 2 things. One is a performance level, which is a percentage of high-performing clinics by district, as well as actual clinic locations with their client load, number of clients who visited within the past 1 month, I believe. As is often the case with the maps, it doesn't tell us why there are certain patterns and why there's 2 or 3 clusters with lots of yellow areas, which means very low performance rate, but it will help us to ask the right questions, and it will help us to identify those areas that deserve special attention and where maybe further investigation is required to find out why those few districts actually have such a low performance rate compared to others. I'd like to now take some time so after this general overview of how we use maps to support our activities, a more comprehensive example of how maps and GIS support a targeted HIV prevention program in Madagascar. And just like many of our country offices, PSI Madagascar is managing a range of different social marketing interventions, different projects, from family planning and HIV prevention to mass bednet distribution campaigns, or behavior change communications on a range of health topics. So let's have a closer look at how they use GIS to support internal decisions about their condom social marketing program, which is mainly targeting female sex workers and their clients in specific high-risk areas. And the main purpose of the project is to provide these target groups with access to condoms, and also to HIV and STI treatment and prevention services, to promote consistent condom use and generally to decrease risky behaviors. The condom brand there is called Protector Plus, and which is distributed to private sector outlets through PSI sales reps, but also through distributors and independent wholesalers. Our team in Madagascar is systematically mapping out all the known outlets, but of course, since we only do part of the distribution ourselves, we don't necessarily know where the products end up once they go through a distributor or a wholesaler. And a lot of small kiosks will get their stock from a nearby pharmacy or wholesaler. So we also do regular monitoring surveys, which we call our map surveys, which allow us to go into certain areas, usually it's based on a random sample, and check on availability and see whether the geographic coverage is sufficient and whether the specific target groups have access to condoms in this case. Now here we can see on this map that a lot of the areas of Madagascar are not covered, all the blue ones, so there are communes or municipalities that are not covered that don't have a single outlet with Protector Plus. However, because the focus of the project is mostly on urban areas, it doesn't matter that much, because most of these are remote, very low population rural areas. And the inset map here on the top shows the situation in Antananarivo, in the capital. So where again you can see the exact location of every single outlet. And the picture shows some of the stages in the distribution process, from taking inventories to moving boxes full of condoms to the wholesalers and to actually going to the shops to make sure that the stock levels are adequate. Now, HIV in Madagascar is largely a concentrated epidemic where general HIV prevalence is low among the general population, but high rates occur among vulnerable groups like sex workers and their clients, and maybe truck drivers and other most at-risk groups, or MARPs as we call them. And for this reason, the project runs a component on HIV prevention, targeted prevention efforts in what we call hot zones, which are clusters usually within urban areas where there's a high number of these hotspots, the venues, the high-risk meeting venues, where sex workers and other high-risk groups are present, just like we've seen in Swaziland. So all the red dots are those high-risk areas or sites, the bars and the hotels, brothels, nightclubs, and so on. We've mapped out all these sites, they're shown in red, and as well as condom outlets within the area. So again, it's very similar to the Swaziland example, except that here we have much more detailed maps, and we're also incorporating the presence of HIV prevention services, as well as HIV and STI treatment and screening sites, which are the top réseau sites that are shown as either green or red crosses. And we'll look a little bit more at the different types of condoms later on. So these detailed maps are really useful tools to determine whether condom availability is sufficient. And again, you can zoom in into a given neighborhood or into a given town. They're also used to plan interpersonal communication sessions that are run by trained peer educators with the target groups in those sites. And as we can see in this town, for example, when we look again at condom availability, we'll see that most of those hotspots are located in this corner, whereas most of the condom outlets are on another street, much further away. So it would make sense to target our distribution efforts and to make sure that those few hotspots have access to condoms either inside or outside in a nearby shop. So it would definitely make sense to focus those efforts in and around the actual hot zones. And it's something that we, in most cases, is very well done. As you can see, most of the areas in blue, which are roughly the extent of those hot zones, have a fair number of Protector Plus outlets in there. And what's also interesting in these maps is that we can disaggregate condom availability by type of condom or by brand. We have 3 public sector condoms, which are shown as blue stars, and then we have the PSI brand, the social marketing Protector Plus outlets in yellow, and then there may be some green squares, which are mostly commercial condom brands. But as we'll see later, there's very few of those. So we found that actually most of the hot zones are adequately covered by the Protector Plus brand, and only a handful of them have a sufficient number of this FIMILO, which is the public sector free generic condoms available. The table here shows these coverage findings, where coverage is defined as the proportion of geographic areas, in this case those hot zones, in which a given product, condoms, are available according to predefined minimum standards of availability. And that could be, for as simple as we need at least 1 condom outlet within the area, or we need X number of outlets per target group size or per number of hotspots in order to consider those areas as adequately covered. And we also see that in this case, other brands, the coverage is no, it's almost inexistent. It doesn't mean that there aren't any single outlets with commercial brands, just that there's not enough of them to consider that people have easy access to those brands. This condom market mapping approach, and by looking at the different sector, also allows us to do things like, first of all, to get a sense of brand diversity, but also look at price levels and other attributes for each of those different categories. The background image here is just another detailed urban map of the capital, just showing a different layer, and you can see there's like every single house has been mapped out, and we typically obtain these geographic data sets from the national mapping agencies. We don't create this ourselves, but we'll see that that can sometimes be a challenge to have access to such detailed maps. And the colors of the dots represent, again, different types of condoms, different brands. We also calculate outlet penetration rates and access ratios among the target groups, as these help us to better understand what's happening on the condom market. So this active use of maps to support distribution and health promotion activities is sometimes called geomarketing, which is a concept that's well known in the private sector, but not so much among non-profits or in the academic world. In a nutshell, geomarketing, it's all about recognizing the value of place and of the location when designing marketing and communication interventions. Knowing where potential customers are located, identifying optimal locations to open a new store or a new clinic, tailoring advertising to specific population segments as well. It's something that private companies are very good at, and we can probably learn a lot from those approaches to make our own interventions more efficient and especially more cost effective. And PSI Madagascar has adopted a true geomarketing approach, a health geomarketing approach I should say, where the map is a central piece of the dashboard that provides program managers with the information they need to implement activities in a cost-effective manner. And just about all the activities that are run by PSI Madagascar are mapped out systematically with varying levels of detail, sometimes down to the outlet level, as seen in the condoms, others more general maps by region or by district that show this is whole collection, just to give you a sense of the diversity of the programs, where we have both commercial distribution, mass distribution campaigns for ITNs and bednets, or we have family planning, there's again oral contraceptives, and Actipal, which is a malaria treatment drug. And now the title here is in French, but it says it's the global overview of activities by intervention area for the period October 2010 to June 2011. And they generate these maps on a monthly or quarterly basis to report back internally, but also to the donors and to other partners within the organization. Something that's not shown here is how PSI is managing lots of different partners through sub-awards, where a local NGO will be responsible for implementing a certain activity in one or two districts. And because the number of partners is becoming quite large, it becomes sometimes quite difficult to manage, and we're using maps to make sure that there is no overlap between the activities of the different partners, and also to ensure that there is no districts that are left out. And I could also show a map that shows radio coverage, or which districts were targeted for a malaria prevention campaign. And generally also knowing, for instance, I was in South Sudan recently, which villages and which towns can be reached through radio communications, because coverage is not universal. A lot of the remote areas simply can't receive radio transmissions. It's important for us to know which areas are covered, so we can again maybe find other ways of getting our messages in terms of HIV prevention out in the more rural, remote areas where people don't have access to data. Now, an active geomarketing approach for health is still pretty much in its infancy, at least among non-profits. As I said, private companies are using it a lot, but we're likely to see it develop much more over the coming years. And we're still facing some challenges. I mentioned sometimes the lack of geographic data, or the quality thereof. And it's something that we're working on. We also need to continue promoting these location-based approaches to health communications and service provision. But we've come a long way, considering that not so long ago GIS was rarely used for actual planning and targeting of social marketing interventions, or any kind of public health interventions in general. And we now have access to much better geographic data through tools like, or systems like OpenStreetMap or Google MapMaker. Some of you may have heard of this, which are crowdsourced tools where anybody can contribute and digitize roads and streets and other types of points of interest, as they're called. And in return, we can use that information in our own GIS applications, and which has made a huge difference, especially in a lot of countries where that kind of geographic data was either totally lacking, or it was very inaccurate or outdated, or it was simply way too expensive. And you'd be surprised at how expensive it can be to buy these GIS layers. It's tens of thousands of dollars sometimes to get a very detailed city-level map. And as I said, that made a really important difference to us. What has also made a significant contribution to making mapping more accessible to a larger public is Google Earth, and I've mentioned this in the introduction. But remember that less than 10 years ago, satellite imagery and aerial photography was really reserved to GIS specialists and cartographers. It was very expensive, not as detailed as it is now, and now we sort of take it for granted. So it's useful to keep this in mind. And we're actually taking advantage of this technology to provide our end users with better and more accessible information on the health services and products that we distribute and provide. For example, through maps like this one, which is a Google map that's publicly accessible, which shows STI and HIV screening and testing sites in Vientiane that are part in Laos, that are part of a network that PSI is a member of. And you can see drop-in clinics. There's a PSI drop-in clinic. There's FHI wellness centers. The blue kind of drops are private doctors who are part of the referral system. And then the red crosses are public hospitals that actually provide treatment services as well. So anyone you can click on a button on one of those points and get information about the name, the precise address, maybe contact details, opening time, types of services provided, and as you know, Google Maps, you can also even get directions, find out how far it is, how much time it will take to get there, and so on. So we hope to see more of those and to make that kind of information much more accessible, whether that's to the end users, but also to the Ministry of Health or other partners who are active in the same area and who may be able to use this information. Right now, what we're seeing also is the emergence of mobile mapping technologies, which allows field workers to use cell phones to record and map out their activities while they're in the field and even have access to maps on their, whether that's an iPhone or a tablet PC. And in fact, in just a few years' time, GIS has evolved from being a typical standalone desktop application to web-based systems, and now into smartphones and tablet PCs to perform real-time mobile mapping and location-based services. And there's obviously a strong link with the various mHealth applications that we're seeing these days. And these services will be able to probably incorporate a true spatial dimension by giving more tailored communications to the end users. For example, by taking into account local risk factors, just by knowing where somebody is, where he lives, or where he's located, to see how that fits into the message that we're delivering. Social media is also starting to play a role in health and humanitarian mapping. For instance, with Ushahidi, which is a platform that was created during to monitor the violence linked to the Kenyan elections a few years ago. And it's also been used, for instance, during the Egypt revolution last year. But it's also been applied to map outbreaks, similar to the map that we saw at the very beginning. And this one shows the 2009 global swine flu outbreak. Again, with all the dots showing the number of reported either suspected cases or confirmed deaths, and one can filter by category of report, and you can zoom into a given area, create time charts. It's all very interactive now. A similar system is that of healthmap.org, which automatically tracks emerging infectious diseases. So they specialize kind of in this niche, based on a range of internet and other media reports, as well as other sources. And in order to generate interactive maps like this one on avian influenza, this is a number of cases, or these are single reports, which again you can click on and find out whether it's a news report, whether it's a an unverified report, whether it's an official report from a Ministry of Health, for example. And both systems also have tools that allow anyone to submit a report. So you can see here, there's a button, submit an incident up there, or something called outbreak missing, added to the map. So it's really crowdsourced. It's a combination of crowdsourced and automatic retrieval of available information in the media. And these are freely accessible, so I've put down the web addresses there if you want to have a look. Now, I'll conclude this talk with a final example, just because it's a nice map, and which shows what we could call the Swaziland condom landscape, which seen here in Google Earth, with all public and private sector outlets mapped out. And again, you can click and find out what the type of outlet or facility is, the name, where it's located, whether male or female condoms are available, which is highlighted in the different colors. And because this is in Google Earth, it also has the advantage that program managers can very easily navigate and explore those places and generate their own maps without needing to be GIS experts and with only very minimal training. As I mentioned, up to not that long ago, mapping was really the domain of experts, of geographers and GIS specialists, and now it's become much more accessible. So that's really useful for the different people that implement our programs. So I hope that these few examples have convinced you that there's a strong link between mapping and health, marketing and communications, in the sense that maps make it easier to see where there are imbalances between, in our case, supply of a given product and potential demand. And for social marketing organizations in particular, they help us to target distribution and demand creation activities in those areas where they matter most. Without this geographic approach, it would be very hard to do this efficiently, and one may end up either with additional unmet demand through too much demand creation, but then there's no distribution that's following, and we've seen that in certain places, or on the opposite, with products on the shelves that aren't purchased, and then we end up with lots of expired products that we need to remove, and that's very cost and labor intensive, of course. So, simply because we didn't go to the right areas, or because we didn't coordinate well enough between the teams who are responsible for distribution and those who are responsible for demand creation among our target groups. So I think you'll agree that the maps have an important role to play, and that to ensure equitable access to essential health products and services in those areas where they're most needed. And now, before I take a few questions, if there are any, I'd just like to share a couple of references and resources that may be useful. First of all, there's an excellent book mostly on the history of disease mapping by Tom Koch, which was recently published. It's called Disease Maps, Epidemics on the Ground. It has lots of interesting examples, old maps that were used, for example, John Snow, but many others, and very interesting stories about the maps and also about the people who made them. The second book is a tutorial, so it's a very practical book on GIS for health, using ArcGIS software, which, as I said, is the leading software, the most powerful and most common software that is around these days. And that's very interesting, I think, for those of you who are already using GIS, or for those of you who are interested in starting to use GIS in health research, for instance. And the 4th edition is actually scheduled to come out within the next few months, I think by June this year. I've also listed PSI's website, where you'll find more information about our mapping surveys, about our availability surveys, and about the different, some examples and some links to resources related to GIS and mapping. Esri.com is the company that creates and distributes ArcGIS, but there's a wealth of information generally about GIS. They also have a section on GIS for health and humanitarian services. And finally, well, there's my own email address here in case you would like to get in touch directly. And I think that the presentation itself will be made available within the next few days on the school's website. So thank you very much, and any comments or questions, I'd be happy to take.